I want to start today with a number, $13,000. That is the average amount of money researchers estimate American retirees lose due to preventable Medicare mistakes over the course of their retirement. $13,000, not from bad investments, not from market crashes, not from bad luck, from mistakes that were completely avoidable, with the right information, at the right time. And here is what makes that number even more painful. Every single one of those mistakes was made by someone who thought they were doing the right thing. Someone who followed the advice of a friend. Someone who trusted what an insurance commercial told them. Someone who assumed that because nobody warned them, everything was probably fine. Today we are going through 5 of the most costly Medicare mistakes retirees make, one by one, with exactly what the mistake is, exactly why it happens, and exactly what you need to do differently. Stay with us. Because if you're within 10 years of 65, at least one of these mistakes is probably on your radar right now, and catching it today could save you thousands. Welcome back to Medicare Exposed. No commissions, no plans to sell, no agenda. Every week we dig into the decisions that follow retirees for the rest of their retirement. If you're new here, hit subscribe right now. Let's get into it. Mistake number 1. Enrolling in the wrong Medicare plan at 65 and assuming you can always change later. This is the most common mistake on this list, and the one with the most lasting consequences. Here is what happens. Someone turns 65. They get a flood of Medicare mail. They talk to a friend who loves their Medicare Advantage plan. They see a commercial with a celebrity spokesperson. They call the 1-800 number. They enroll in Medicare Advantage. And for the first few years, everything seems fine. Then their health changes. Their doctor leaves the network. They need a specialist who isn't covered. They get a prior authorization denied. And they decide, I need to switch to original Medicare with a Medigap supplement. And in most states, they can't, because their guaranteed issue window closed at 65. And now they have health conditions that make them uninsurable in the Medigap market. The mistake wasn't choosing Medicare Advantage. The mistake was choosing it without understanding that switching back, after a health event, is nearly impossible. The fix: before you choose any Medicare path at 65, talk to a SHIP counselor. Free, unbiased, no commission, shiphelp.org. Understand the full implications of every option before you lock yourself into one. Mistake number 2. Not reviewing your Part D drug plan every single year. This one costs retirees money quietly, year after year, without them even realizing it. Here is how it works. You turn 65, you pick a Part D drug plan. It covers your medications reasonably well. You set it and forget it. Every year, during open enrollment from October 15th to December 7th, you ignore the letters Medicare sends you. And every year, your plan quietly changes. Premiums go up. Drug formularies shift. Medications that were in a lower cost tier last year move to a higher cost tier this year, or get removed from the formulary entirely. And because you didn't review your plan, you are now paying significantly more for the same medications, on a plan that no longer fits your needs. The fix is simple. Every single year, during Medicare open enrollment, go to Medicare. Gov Plan Finder. Enter your zip code and your current medications. Let the tool compare every available Part D plan in your area. Pick the one that covers your specific drugs at the lowest total cost. This one review, done once a year, can save hundreds to thousands of dollars annually, and it takes less than 30 minutes. Mistake number 3. Not telling Medicare about a life-changing event that should reduce your IRMAA surcharge. We covered IRMAA in detail in video 8, but this specific mistake deserves its own spotlight, because it costs higher income retirees thousands of dollars every year. IRMAA is the income surcharge Medicare adds to your Part B and Part D premiums, based on your income from 2 years ago. If your income 2 years ago was high, but dropped significantly when you retired, Medicare is still charging you at the old income level, and most people just pay it. They assume it's automatic. They assume Medicare will figure it out. It will not. Medicare will not automatically adjust your IRMAA surcharge when your income drops. You have to file an appeal. Using Form SSA 44, available at SSA.gov, the qualifying life events that allow you to appeal include retirement or reduction in work hours, death of a spouse, divorce or annulment, loss of income producing property, loss of pension income, employer settlement payment. If any of these apply to you, and you are paying an IRMAA surcharge, file that appeal immediately. The average successful IRMAA appeal saves retirees $1,000 to $5,000 per year, per person, and the form takes less than an hour to complete. Mistake number 4. Choosing a Medicare plan based on premium alone. This is the mistake that the entire Medicare Advantage advertising industry is built on. $0 premium. It sounds incredible. And for healthy people who never use their insurance, it can be. But insurance is not designed for people who never use it. Insurance is designed for the moment you actually need it. And the moment you actually need it is exactly when a $0 premium plan can become your most expensive option. Here is the reality. A $0 premium Medicare Advantage plan may have copays of $50 to $100 for every specialist visit. Prior authorization requirements that delay or deny procedures. Out-of-pocket maximums of $8,850 per year. Network restrictions that exclude your preferred doctors and hospitals. Meanwhile, a Medigap Plan G, with a monthly premium of perhaps $150 to $200, covers your 20% co-insurance, covers your Part A deductible, covers your Part B deductible after the first year, and gives you access to any doctor or hospital in the country that accepts Medicare, which is virtually all of them. The total cost of healthcare in retirement is not determined by your monthly premium alone. It is determined by your premium, plus your deductibles, plus your copays, plus your co-insurance, plus any costs from denied claims or out-of-network care. Add all of those up across a year, and the $0 premium plan is very frequently the more expensive option. Never choose a Medicare plan based on premium alone. Choose it based on total cost and total access to care. Mistake number 5. Not planning for Medicare costs before retirement. This one is different from the other 4. Because it's not a mistake you make inside Medicare. It's a mistake you make before you ever enroll. The average couple retiring today will spend over $300,000 on healthcare costs in retirement. According to Fidelity's annual retirement healthcare cost estimate, $300,000. That includes premiums, deductibles, copays, dental, vision, hearing, long-term care, and everything else Medicare doesn't cover. Most people planning for retirement calculate their housing costs, their food costs, their travel budget, their entertainment, but they dramatically underestimate or completely ignore healthcare as a retirement expense, and then they retire. And reality hits. The fix is to treat healthcare as a budget line item, starting now, before you retire. Estimate your Medicare premiums based on your expected income. Price out a Medigap supplement in your area. Budget for dental and vision coverage separately. Have an honest conversation about long-term care and whether long-term care insurance makes sense for your situation. Build a healthcare budget into your retirement plan, the same way you build in housing and food, because healthcare in retirement is not optional, and it is not cheap. The people who plan for it are the people who can afford it. Let's bring this together. 5 mistakes, 5 completely avoidable situations that collectively cost retirees an average of $13,000 over the course of retirement. Choosing a plan without understanding the switching consequences. Letting your Part D plan auto-renew without comparison shopping. Paying an IRMAA surcharge that should have been appealed. Choosing a plan based on premium instead of total cost. And walking into retirement without a healthcare budget. Every single one of these mistakes has a fix. Every single one of those fixes is available to you right now. The only thing standing between most retirees and these costly mistakes is information. And you just got it. If this video helped you, or if you know someone approaching retirement who needs to hear this, please share it with them right now. Hit subscribe and turn on notifications, because next week we are finally diving deep into Medigap. The supplement plans that protect you from the uncapped 20%, give you the freedom of original Medicare, and cap your out-of-pocket costs at a predictable monthly premium. We'll cover every plan letter, which one most advisors recommend, and exactly how to pick yours without overpaying a single dollar. We'll see you there.